for the right central. And if we measure the width, it's measuring a bit over 8 millimeters. We're approaching maybe 8.5 millimeters in width. So the tooth is relatively square in form. If you'll notice, the other central incisor is essentially a mirror image, approximately, again, 8.5 in width, and the length of it will be also about 8 millimeters. And if you look at the form of the gingiva, the central incisors have a relatively flat contour of the gingiva, and the level is relatively even with the patient's left lateral incisor, but on her right side, the right lateral incisor gingival margin is in a more apical position, as is the canine. So there's an asymmetry from left to right sides, with the right side being at a fairly good level, but you wouldn't like a lateral incisor to have a greater length than the central. So we will need to adjust the gingival level so that it is equal across the anterior and in harmony with the posterior region, and we'd like the central incisor margins to be somewhat level or on the same level as the canine margins. So the first thing we do is locate the CEJ, because we're looking at a clinical crown and we need to determine the position of the CEJ to know the length of the anatomic crown. So we'll probe in the sulcus and feel the enamel as far as we can until it changes contour, and we'll know we're near the CEJ. And it appears that that's about 3 millimeters beneath the gingival margin. And we'll place the probe on top of the tooth and the gingiva and look at the length and look at the amount of gingiva we would have to remove. We next need to see, is there sufficient attached gingiva to excise the amount we need to expose the anatomic crown. So we find the mucogingival junction by moving the mucosa down. The mobile tissue will stop at the mucogingival junction, and then we can get an accurate measurement of the width of gingiva from the mucogingival junction to the